Hey everyone, welcome back to another edition of the DrByCusmet.com podcast. My name is Kevin Henry. Honored today to be joined by Dr. Josen Gastelum. Dr. Gastelum, how are you today?
I'm pretty good. Thanks for having me.
Hey, thanks so much for being on today. I'm excited to talk about you about what's going to be a very interesting topic, I think. But before we dive into that, I'd love for our audience to know a little bit more about you.
Sure. So I'm Dr. Josen Gastelum. I currently practice in Scottsdale, Arizona. Beautiful most of the year, pretty miserable right now. But I actually do a lot of general cosmetic dentistry, and that's my passion right now. But I also do social media, so that's kind of how I'm known on the internet as Dr. Josen. So I do some comedy, some educational videos, some personal videos in there, and thankfully have had some great opportunities that have come with it, including networking and connecting with patients, pre-dental students, other dentists, and even people from other professions. So it's been awesome.
And I know Dr. Josen has a great Instagram page, I can tell you that. So we're going to make sure to link that in the show notes so that you will be able to follow along. Because I promise you, I love that you work in your team, obviously, with those social media posts as well. It's so great to see.
Yeah, I think it's honestly a great way to incorporate like team morale and just make everybody excited to come into the office and show patients a little bit of our personality as well. So when they come in, it seems a little bit more approachable.
That's awesome to hear. Well, I want to dive into a topic with you today as a cosmetic dentist and somebody who's really out there on social media. And that is when somebody walks into your practice with periodontal disease,
Mhm.
but they want whitening or they want something else done cosmetic wise. What kind of conversation is that for you and your team for
Mhm.
that patient?
Sure. So I think that's always a really tough question because when people come in, the first thing that people notice obviously is your smile. And so for most people, they want their smile to look great and beautiful and white and all of that, right? And a lot of people don't think about what the implications are health-wise for what your mouth looks like, right? And so I think a lot of the conversation when it comes to these things for me is asking patients for permission to offer what I would want to know. So that's something that we've taken a couple of courses in our practice on how to speak to patients about that. And one of the things that they tell us to do is to ask the patient, do I have your permission to share everything that I would want to know? And that kind of gives you an idea whether or not the patient is open to hearing about the discussion or not. And most patients will say yes, or they'll be confused and be caught off guard, and then suddenly they're paying attention, right? And so a lot of my conversation about this is I talk about how the hygienist has done their comprehensive review of their gums, and so they're measuring the amount of gum that there is left on the tooth where it's attaching. And a lot of dentistry is about building that foundation in order to have a good and healthy smile and a beautiful smile. And so, how I usually explain it to patients is you wouldn't want to build a house on a bad foundation. You want to make sure that the foundation is strong and durable before you're building on top of it. And that usually, for the majority of patients, does the trick for helping them to understand why it's so important to take their periodontal health um, at a greater standard than trying to just whiten their teeth or have a cosmetic result. And yeah, and so I think that that's super powerful. That statement of asking people patients for permission has really changed the game when it comes to acceptance of like periodontal therapies or helping people to understand why we're prioritizing it.
And it sounds like to me you've got your entire team on board with this. So you're all kind of speaking the same language. How important is that whenever it comes to managing patient expectations?
Yeah, I think that's huge. It's important because patients can totally what's called like suss you out. They can totally know when you're aligned with your team and when you're not. And so, like currently, we have a couple of temp hygienists that come in, and because we have such a big population that comes to see us, sometimes we need that temp hygienist, and you can immediately tell how you act with the hygienist that you've trained versus a hygienist that's a temp hygienist, just because of the verbiage that you're giving. And so I think that that's really important for success, not only for the practice, but for patients to understand and get your recommendations and take them seriously.
You are so active on social media, and one of the things that I know is that social media also perpetuates those beautiful smiles, and the patients will often come into the practice seeing something on social media or with one of their favorite movie stars. How do you help manage the expectations of what they see versus what may be right for them?
Sure. So I think that it's definitely important for patients to come in with a lot of inspiration, pictures of what they want to do, because a lot of things are achievable with the correct treatment planning. So you always have to begin with the end in mind. I have heard the concept of under promising and over delivering also, and I think that that's huge as well. So with everybody's specific case, you're going to give them very realistic expectations of things, and essentially let them know what's achievable within their own smile. But then at the end, if you most of the time you should be able to give them a result that they're really happy with. And I think that the majority of the time when you set those expectations at a more reasonable level, when you actually deliver these great results, the patients are super excited and over yeah, they're over happy with it. So
So you mentioned the temp hygienist coming in, and I'm just curious how, you mentioned a little bit about making sure that they're on the same page. How important is it? Because I know a lot of dentists who will listen to this have those temp hygienists as well. Is that something you have a conversation with before they come into the practice about perio and things, or how do you
yeah.
kind of lay that groundwork?
Yeah, so I think a lot of that is managed when we do our morning huddles. So when we do our morning huddles, we try and speak about every single patient in the list. And as we're going through, we usually, if we've seen the patient for a while, we can give the hygienist some tips on certain things to look out for, things that the patient will probably ask about. And definitely, it's one of those things that I think it's difficult because everybody comes in with their own background of what they teach, and sometimes it's just learning in the moment. So as you're working, you work with that the first patient that you do that first hygiene check with them, and you see how they interact, and then afterward you can have a conversation before the next patient comes through on how to better explain that. But I think it's just one of those things in dentistry, and especially right now in dentistry where hygienists are like at a shortage with a lot of practices, and it's something that we just have to kind of get through.
You mentioned you're in Scottsdale, and I'm curious, how have you used social media and other means to make yourself stand out in what I know is a very crowded marketplace down there?
Mhm. Yeah, I think a lot of it has to do with using the right, I guess, like keywords when people are searching things up. And so a lot of things initially, it was a lot about like the hashtags and all that kind of stuff, and it still is. But selecting the correct words, because a lot of these social media pages are now essentially like Google, and so people will go into the search bars on like TikTok or Instagram and search dentist in Scottsdale or like veneer Scottsdale. And so these things, when they pop up, then your videos pop up in those areas, and that's how like I've gotten a lot of patients actually. So sometimes the patients that I've gotten are from some of the funny videos, but the majority of the patients that I've gotten are from like educational videos. So I've made a video about like icon resin infiltration, for example, and I had a patient that had searched that up and saw me and came to see me. And then I had another one that I had posted about something with Invisalign, and I had a patient that had searched something about Invisalign, and it said Scottsdale, and they came and saw me for that. So I think that choosing those keywords and trying to make yourself come up first in the rankings, it makes it huge.
I know you mentioned earlier the importance of asking for permission, and how important that is. Is that the biggest tip that you would give to your fellow dentists as far as trying to work in the perio side of things whenever somebody may want the cosmetic dentistry side of things first?
Yeah, I think that's the best way to approach these kinds of conversations, because a lot of times they're very tough because patients come in either with a bad taste from a previous experience that they've had, or a lot of times, they think that we're trying to like upsell or something like that, when in reality we're just looking out for their best interest in health and having a long-term prognosis. And so I found that statement of asking for permission really helps to weed out which patients are actually serious about their health and which ones aren't. And if people aren't ready to have that conversation, then that means that the practice might not necessarily be for them, and not every practice is for every single patient. And I think that that's something that we have to understand as dentists as well, where we're willing to make that line for patients and understand their expectations, but also know what we know is best for their health.
And I'm really glad you made that point because I know so often dental practices and some dentists are worried about saying no, not only because of turning away the patient, but also then what might come out on social media about that as well afterwards.
Yep, yep. And I think one of the things in dentistry that I think is I only learned once I started going out and working, is like the difference between like scaling in the presence of gingivitis versus somebody who's like full blown periodontal disease. And there are a lot of cases when patients come in and, like, let's say they've been getting consistent cleanings for a while, but they still have like calculus underneath their gums because they were only being cleaned on the top of their teeth, and they don't necessarily have like the bone loss that would indicate that they need a full-on SRP, like scaling and root planing. And so in these cases, I think the value of a scaling in the presence of gingivitis is huge as well, and being able to bring that up to patients and present that as like an alternative, I think also helps a lot with managing patients' expectations and getting patients cleaning done the same day, but then bringing them back for a prophy and getting them back on schedule.
Well, before we wrap up, I want to make sure people know where they can learn more about you and absolutely plug away that social media as well. And again, we'll have that in the show notes too, but would love to
Sure.
have you.
So I'm currently on TikTok and Instagram. I do technically have a YouTube as well, but don't really use it as often. But it's at Dr. Josen. It's at Dr. Josen with the
There you go.
my first name here. And yeah, I really love to connect with people on there. I love to I work with a bunch of different brands. Like, for example, I partner with TheraBreath, which is a brand that I really love and I use personally. So like it's given me a lot of great opportunities, and I think that it's a great way to reach different audiences, not only patient wise, but within our own community.
Well, Dr. Justin, thanks so much for the time and the insight today. I really do appreciate it.
Yeah, thank you.
And thanks to all of you who listen to this episode of the DrBicuspid.com podcast. We love bringing in experts from around the industry to talk to you about some hot topics, and I think we tackled one today. So until next time, Kevin Henry, editor in chief of Dr. Bicuspid, signing off and wishing you nothing but success ahead.